there, and welcome to the Reflection Show with me, Martha Inspires. We have heard so much about cancers, and a lot of us actually pay much attention to it when we know someone who has cancer or we ourselves has cancer. We've not made so much effort to be able to prevent it or manage it. Some of us have not even gone for a test to be sure whether we don't have cancers. Then by the time we realize it's at the last stage, that is very dangerous. Today we'll be having a conversation about cancers, how we can all prevent it, we can manage it, or who is at risk of cancer. As a reflection show with me, Martha Inspires, let's take a breather. When we are back, we delve into this conversation. Growing up, it was so difficult finding answers to all the questions that bothered my young mind. As soon as I found my purpose and understood my mandate, I made it a mission to answer as many questions as possible bothering young people. I have mentored, inspired, and helped young people unearth their potentials through the Martha Inspires Foundation. However, I feel it is time to bring the conversation much closer to you. We have you in mind, you the young person. With my team of experts, we bring to you the Reflection Show, a show that focuses on addressing issues young people face, helping them to unearth their potentials, and giving them nothing but the best avenues in helping them solve issues that they may face in their young age. Join me, Martha Inspires, every Thursday and Saturday at 8:30 p.m. on Truth TV, the Reflection Show, restoring hopes. Welcome back from the break. Like I said earlier on, we are looking at cancers, how all of us can make sure that we are safe and not at risk. I have here with me Madam Boryang Margaret. She's a palliative care specialist here at the Tamale Teaching Hospital, right? If you've watched my episode with her where she spoke about who a palliative care nurse is, that video actually got a lot of comments on who a palliative care nurse is. It was my first time also hearing or knowing what or who a palliative care specialist is and what they do. Thank you so much for joining me again on the show.
Thank you for having me.
Today we want to look at cancers. If we talk about cancers, what do we mean? What do we mean, cancers?
Okay, so cancer is a broad term, a broad term used to describe so many diseases. So you can say that cancer is a disease characterized by abnormal growth of cells and proliferation of those cells. So they are not supposed to be growing in a particular part of your body, but they find themselves there and they are multiplying so fast. So it's invading on what? The normal processes of that part of your body. That is cancer.
Okay. What makes us at risk? What do we do? What can we do or should not do that can put us at risk of probably having a cancer?
Actually, science has not yet come out to say this is the cause of cancer. Like you can say in the case of malaria that the mosquito, Anopheles mosquito causes malaria. For cancer, you can't specifically say it is this. But there are so many factors that we think that keeps you at a risk. A combination of them exposes you to having a higher chance of getting cancer. And then some of them are genetic.
Okay.
So if, cancer runs in families, if you have a close relative, a sibling, a parent who has, probably been diagnosed of cancer before, your chances of also having a cancer are higher. Then environmental factors. Our environment is now, filled with pollution, smoke, dust, and all those things. When we inhale them, they stop the normal, they can hinder the normal processes of our body, and so can prone you to getting cancer. Also, our diet,
Okay.
the kinds of food we now eat. We are avoiding the vegetables and fruits, and we are eating any other thing. So the healthy living is no longer there. And it is these foods that help us, our immune system, boost our immune system, so that we don't fall prey to small diseases. Also, another risk factor for cancer is smoking.
Okay.
Yeah, so people who smoke tobacco has caffeine in it and all those things, and so they also go in a way to hinder the normal processes that should be taking place in your body. These and many others can expose you to getting a cancer.
So many years ago, we heard that adults, or even sometimes even an aged person, have died out of cancer, had cancer, and we thought that the elderly are those at risk because they are growing and they have all these things. And even by the time they are dying, they are about 60, 70, sometimes even in their 80s. But now we hear young girls even having cancers. What is changing, or what has changed?
Yes, so your risk for getting cancer increases as you age. But like you have rightly said, it's now like it's the opposite. We, the young ones, are the one now being diagnosed of cancer. You can trace that basically to our lifestyle. We are now living a sedentary life. Exercise is no longer part of us. Eating healthy isn't part of us. Smoking, even sleep.
Okay, we don't sleep
enough.
We don't rest enough.
We are with our phones, and then sometimes with the phone in your hand and you doze off. So we don't make quality time for things that will promote our health. And that, is part of the cancers being, common among the youth, these days.
We see, I like the fact that you've mentioned smoking, but we see a lot of environmental pollutions happening. Are they all risk factors? Maybe the bush burning, those who deal in these crops. There are times that they are breaking things and burning things. There was even this documentary about it, where children are inhaling hard substances. Are these all risk factors?
Yes, they are all risk factors. They are all risk factors. So such exposure to these kind of the air we breathe, certain areas we even stay. Sawdust, carpenters will deal with these things for a long period of time. You see that the effect might come. So the environment, actually, people are exposed to bad environment. The air you breathe is not pure. Your chances of getting lung cancer are high. So basically, the environment is a risk for all of us, because that is where we live. Sometimes it's like it's something you can't do away with. If in your environment someone is burning a tie, in your environment they are using some chemicals to fish now and all those kind of things. So you can't do much, and so you live with it, but that gives you a higher risk of developing a cancer later on.
Let's look at the types of cancers. I know of cervical cancer, breast cancer, prostate cancer, lung cancer. Like, I think this is what I can remember for now.
So there are actually many cancers. And cancer, like I said, can affect any part of your body. So
that's the abnormal growth. Let's say in this part of your body, it's supposed to be in a normal setting, but some abnormal growth comes in. That is cancer.
Yes. So if, let's say, we're having an abnormal growth even on your skin, then we'll term it as skin cancer. If your blood cells are supposed to be multiplying in this way and it's abnormal, then that becomes blood cancer, which we call leukemia. So we have cancer, and it can be in any part of your body, and the name, it adapts where it is growing. So if it is in your stomach, they'll call it gastric cancer. If it is in your large intestine, it is colorectal cancer. So you have mentioned prostate cancer, you've mentioned breast cancer, We have liver cancer.
Okay.
So people who have hepatitis B or C, for a long time, and then it is poorly managed. You see that they also have a higher risk of getting liver cancer.
Oh.
They have the cervical cancer, the prostate cancer, and many others, depending on where it is growing. I have nursed a patient who had a cancer of the eye. So the abnormal cells were growing in the eye, and then from inside you could see that it grew outside, it became like a wound. So that was what? Cancer of those cells there. So basically, wherever those abnormal cells are growing, the name is given as such.
And you've also mentioned that there's no cause. Like, okay, there is no known cause. The only thing probably we can say is when it's genetic, right?
So the genetic, you can't also say that's a cause. It's a risk factor.
Okay.
It just increases your risk of getting it. And then hormonal imbalances too. Women, we have periods where you are ovulating and some hormones are higher than the rest. Or you are menstruating and then your hormones, some are supposed to be higher than the rest. So when those hormones don't balance well, then it can, start up some abnormal growth there. Also with men, the prostate cancer, they also have hormones that, keep their prostate healthy. If those hormones do not balance well, their chances of maybe developing an infection or developing a cancer is higher. So hormonal imbalances, adding up to the genetic factors, adding up to the environmental factors, the diet, the foods we eat, the sedentary lives we are living, we are no longer exercising and all those. A combination of these can, make you develop a cancer. But you can't say one of them is the reason why you have, say, a cancer.
Okay. I actually hear that they said the last stage, that is, it means that one day, unless there's a miracle, you're just going to die. Are these symptoms that one can use to know that I have cancer?
Yes.
Maybe the first stage or something.
Yes. So cancer comes with symptoms throughout the stages. So if it's just a cancer beginning, normally the symptoms include pain. Certainly if something is abnormal growing somewhere, it's pressing on the blood vessels there, it's pressing on the lymphatic system, even other tissues and organs. It's pressing on, and so you will always have pain, either headache, abdominal pain, or pain at that particular site. Then you see that unintentional weight loss. People can say, I want to put myself on this diet to lose weight. But then you have not done that, and then you are losing weight. Poor appetite, you no longer have appetite for the things you used to crave for, or the amount of food you even used to eat, you can no longer eat like that. Then fatigue, they easily become tired. So when you begin to see such signs and symptoms, the best is to go to the hospital, they run tests, and then if it is cancer, it can always be detected early. And when it is detected early, of course, then there is treatment, there is management. But if it goes to the advanced stage, or maybe you even started going to the hospital when you started, experiencing these symptoms, but the diagnosis was not well done. So you went and then they probably said, oh, it was malaria. Then you go again with similar symptoms, and then it was, say, you had a lung infection, and they are treating that, and they've not diagnosed rightly that it's cancer. Then it keeps advancing. So if it has advanced and goes to the latter stage where they can't do much again, then that is where you are left with probably only palliative care, which is supportive care and taking care of your pain at that stage.
I like some are able to go for, they call it chemotherapy.
Yes, so the treatment options are
the extent that they don't even have the cells again. So before we come to the treatment options, I want us to look at the different cancers, even though breast cancer, of course, is in the breast and all that. Just touch a bit on some of these common ones.
Okay.
The breast, the prostate, the cervical, at least these three ones, how they affect or how different they are from each other.
Okay, so for breast cancer, basically, it's not only women actually who get breast cancer. Men also get breast cancer because we all have breast, the breast tissue. So the risk factors that are associated with breast cancer, genetic is still one of them. The diet we eat, then hormonal imbalances, like I mentioned, you know, the breast, when you're ovulating, you feel your breast is a bit bigger or heavier. When you're menstruating, there are certain symptoms and feelings that, you know, you go through. So all those things can add up to what? Give you a higher risk of getting breast cancer. The same thing with prostate cancer. If the hormones are not balancing well and there's an infection which is not treated well, it can eventually result in prostate cancer. Then liver cancer, alcohol intake. Excessive alcohol intake. As we take in alcohol, it all goes to be processed in our liver. So when you take it in larger quantities, you are kind of stressing the liver. So its normal function, you have overworked it.
Yeah.
And when you overwork an organ, and it needs to rest, sometimes it's sick, isn't it? And so it is resting and cannot perform its function again. So your chances of getting a cancer, a liver cancer also, is higher in that case. So alcohol, and then the kind of foods we eat. Now the foods we are eating are full of cholesterol, in fact, bad cholesterol. And all these things are being deposited around your liver, you know, and will eventually, you know, make it sick. And once it's sick and it can't function, then your chances of what? Having abnormal cells growing there is higher.
Then cervical cancer.
Yes, so cervical cancer too, prone only to women also. So we have a human papilloma virus. You know, these days I hear a lot of young girls having white discharge, and they don't treat it, they take it for granted. So if you don't manage these
they confuse it with the normal vaginal discharge.
But the abnormal one is there. It will be smelly. The amount is much than the distance. So when you start seeing such signs, you need to report. So if you don't manage these infections that are coming well, you see that it's like you have made your cervix kind of prone to so many things. And so frequent reinfection can lead you to probably developing some abnormal cells growing there. And so you will have what, you know, cancer of the cervix as well.
Okay. Now, we see a lot of, let me say, people that do not access the hospitals, especially like something like cancer. A Ghanaian would probably, not every Ghanaian, of course, but most Ghanaians would just go to the hospital because they feel this pain here, they feel that pain here. Is there a particular pain or symptom that when you see, you can say that, oh, this up to 70-80%, I think I have to go and check if I'm at risk of cancer?
So that is the pain, like we're mentioning. You are having frequent pain. Your appetite is reducing. You are losing weight when it's not, you know, you didn't plan that. You are not fasting, say, for a longer period of time. You have realized that you have lost weight, you know, and no, sometimes you see changes in your skin color. So if it's the breast, you may feel a lump there, very tiny lump. So that is why we are all encouraged as women to, you know, check ourselves, you know, breast screen yourself, go through your breast at a certain period of your month, your menstrual cycle. So that if you detect any small lump, which you know that normally you didn't have that, then you are supposed to be seeking what, you know, for help, you know, at a health facility, so that they do thorough. These signs I've mentioned, they can be in any other disease.
Okay.
So for you to be on the safer side, when you have them, the best is what? To go to a hospital and be checked, so that you rule out that, oh no, it's not cancer, it's a different thing. Then you can be given, you know, treatment.
Okay, so you've been at the hospital. Do you think that we are usually scared to come check for cancers?
Yes, so I know people are scared. Some people even at the mere mention of hospital, then they know they prefer, let me go to the pharmacy and just say that this and this is, and they get drugs. But I think we should move away from that. The hospital is supposed to be a friendly place, supposed to be where we all go to check to find our health status. It's better you know where you stand than you don't know. So if today I go and they tell me that I have cancer and it is just small, you see that my chances of getting treatment are many than if I allow it to become big, then my chances become 1 or 2. So you narrow your chances of getting cure. So the best actually is to, you know, you may have to do away with your fears, whatever prejudice you have about the hospital. And when you hear that there are screenings also, breast cancer like this month of October, you know,
everyone is screening.
Yes, everyone is screening. These are opportunities for you to screen. You know, I think prostate cancer today is in November for prostate cancer and liver cancer. All these have days, and usually the
awareness,
yes, and there's screening in hospitals. Even if it is at a fee, I don't think it is.
Your health is important.
Yes.
So why are we working? We are working because we want to enjoy the money.
Exactly. So if it has a fee, you go and then they screen you, and you know your state. And then when you know so if you go and let's say it is just at the initial stage, and you then come and start eating healthy, you start exercising, you know, you see that you are able to conquer it, than you are not aware and you are continuing with maybe your lifestyle, which will worsen it very fast for you.
I want us to look at the treatment options, but let's take a break. We'll be back.
My name is Naima. I have a challenge with my aunt since I was in basic 5. If I'm in class learning on the board, it reflects. So I can't see well, I can't read well, so I have a problem with learning. So when I heard about the eye screen in Matter Research Foundation, I decided to come over and see how it will help me, and I'm very happy to be here today.
Welcome back from the break. We're still looking at cancers and just encouraging every one of us to do well, to go and check. We are all at risk because no matter what we have mentioned, even if you are not drinking excessively, you have probably taken substances in, or even just passing by a bush several times. Those are the villages where we are always using firewood to cook. Or is that farming season, or dry season, where we want to burn our bushes because of dangerous animals, etc. So we've all been at risk of one of these risk factors. Let's do well to get to the hospitals to check. You know, sometimes when you hear hospital, apart from the money, sometimes it's the queue. You don't want to get to the hospital to queue. And sometimes when you go and you are not like sick, and I'm coming for a checkup, it's like the doctors don't want to pay much attention to you because the patient to doctor ratio is very low here in the country. So they'll be like, oh, let me attend to those who are actually very sick. Now you dear, you are even still strong walking about. But I've seen people who on a normal day they are walking, they are fine. And they just say that, oh, I have headache. I'm feeling pain in my chest, only for them to get to the hospital and you hear that they are dead. And I'm like, how? But probably they've had something in them that they haven't really taken care of. Now let's go back to cancers and look at how can we get it treated.
So there's treatment depending on the stage, you know, and the type of cancer.
Okay. So let's look at the stage. How many stages do we have?
We have, it depends on the type of cancer,
okay.
But we can have stage 1, 2, 3, and even 4.
Okay.
Stage 4 of, you know, depending on the type of cancer. So 4 certainly is the worst part of, you have reached the worst part of the disease such that it's going to be so difficult to reverse it. But if you are at the first stage where it is, you know, the growth has just started, the treatment options are many. So they can always have a surgery done on you to remove those abnormal cells away, because now they are just small at a localized area. So a simple surgery to remove the abnormal cells can be done on you. Or you could also have chemotherapy. So chemotherapy is drugs. You are either given to swallow or they are given to you per IV. And then they are powerful drugs actually, and they go there to shrink the cells. So if it was this big, they can make it very small. So it's no longer having that impact on you again. Or they kill them completely. The chemo drugs are able to kill the cells completely. But the chances that they can reoccur are there. Okay. Usually before you go for these treatments, you are educated on all of this, so that after the chemotherapy, if cancer cells are reoccurring, you don't think that probably the chemo did not work. Yes, it can work, but it can always reoccur. So also, you can have radiation depending on the stage also. So radiation also are powerful energy cell rays, and they also go to shrink also the cells, and then stop the growth. So because cancer cells actually, they multiply very fast. You see it today and tomorrow is bigger than what you saw. It's so fast. So radiation also can go and then stop that multiplication, so that wherever it is, it stays there. So that is what radiation does. Then you can have
chemotherapy, radiation,
and surgery. These are the three I've mentioned so far.
Okay.
Then you can have immunotherapy. So immunotherapy basically is to boost your immune system, so that your system is kind of ready to fight the cells, and that comes in with our kind of eating, eating healthy. Vegetables and fruits, contain antioxidants, and these are very important in the body. So if you take more of these, you have boosted your immune system. It's like it's ready to fight anything that is not supposed to be there. Then you can also have hormonal therapy, like I mentioned, because of normally we have hormones in us. They increase, they decrease depending on what's happening in our bodies. If these hormones are not working rightly, because some are maybe higher, abnormally high or abnormally low, then a hormonal therapy helps this person. So if it is too much hormones, they give you drugs that can reduce the amount of hormones in you. Or if it is that it is too low, some drugs are given to help raise the number of amount of hormones in you, just for a balance in your body that will prevent any abnormality in developing your body. So these options can be combined. You can do a surgery and still do the chemotherapy.
Okay.
You can have surgery and the radiotherapy. You can have the three together. All are just geared on one person, depending on the stage.
Let's go back a bit on the surgery. How is it done? I think I missed out a bit on that, the surgery.
Okay, so surgery, if let's say it's a breast cancer which has started in your breast, and it has not yet, actually cancer can spread.
Okay.
It starts in your breast, and then if you don't manage it well, it can spread, say, to your lungs. It can spread to your liver. So if it has not yet spread and it is still just in your breast at a localized area, they go in for surgery, they cut and they scoop out, or let's say they cut out the abnormal cell and then close the cut back. So you only have the wound to dress.
Cut your breast, go in.
And take out the abnormal cells. They are not supposed to be there, so they will take them out.
Wow.
So sometimes so that's what I'm saying, it depends on the stage. If the stage is such that after surgery, they still have to use radiation to completely kill what could not come out, then you have the radiation or chemo after surgery. So a combination of all these options, it always depends on the type
radiation, hormonal, surgery,
chemotherapy,
chemotherapy,
and immunotherapy.
Immunotherapy. These are the 5 ways where a cancer patient can receive treatment. For all the types of cancer. You can use any of them.
Yes, you can use it. So it depends on that. So maybe a particular cancer, you may not be able to do radiation.
Okay.
So that will not be an option for that particular cancer. But where the radiation can reach that particular part of the body and target those abnormal cells, it will be an option. The other option is palliative care. So if you are at the latter stage of the cancer, where a surgery cannot be done, chemotherapy cannot be done, radiation cannot be done, what you are left with is to manage your symptoms you are presenting. So if the patient is in pain, what can we do to take away the patient's pain? Patient has emotional issues. What can we do to help the patient, not be down and those? And so at that stage,
just managing the patients to
be comfortable.
And later on,
at whichever stage, we can all die. But at whatever stage you are, if the other options cannot help you, then it's comfort and supportive care that will be given to you.
Wow. I want you to talk a little about the palliative care. People might just hear palliative care, but they don't understand what a bit. So how do you handle a cancer patient with palliative care?
So palliative care basically is what to improve the quality of life of the patient who has been diagnosed, with a terminal illness. That is a condition that the patient is going to live with till he or she dies. So the basic thing with palliative care is what? To give you comfort and support. And if you give somebody comfort and the person is in pain, you try to reduce the person's pain.
Okay.
If you give someone comfort and the person cannot eat well, so what do you do so that at least the person can take something small? The person is sad because he's not able probably to go out with friends, do his or her work. How do you help such a person that even though you have cancer, but you can still see your friends? If it is that you can't go out, maybe your friends can come.
Yeah.
So basically that is palliative care. Pain management, emotional support for not just even the patient.
In layman's term, pampering.
Yes, yes, yes.
So you pamper the person and make sure that they are still happy mentally, emotionally, psychologically,
Exactly.
when you cannot help them with the health wise
Yes.
and all that. Okay. Is it expensive managing or treating cancer?
I think our healthcare system in Ghana is expensive because health insurance don't cover so many things. So cancer, for the average Ghanaian, I would say it's costly because before you even be diagnosed, the tests, you have to run a lot of tests. We can't look at you and say that you have cancer because you're having a headache. We can't say that is cancer. So you need to run a lot of tests, and so before you even be diagnosed, you have to spend money doing all these tests. And then when you are diagnosed, these are the treatment options: surgery, chemotherapy, and they are all what?
Expensive.
Expensive.
Yeah, costly.
For the average Ghanaian, will say expensive. Maybe some other people, it might not be expensive. And then it's more, I would say it's more cheap, or let's say less costly, if you just come at the initial stages. Come at the initial stages.
Initial stage, that is when you are diagnosed early enough.
Or when you start seeing these symptoms and you report, and then they say, oh, it confirms cancer.
So now I want us to look at, are there some common type of cancer that are like in young people more, that you diagnose more? Like, have you observed there are a lot of maybe like, yeah.
Yeah, so yes, young people, mostly the breast cancer, liver cancer because of the alcohol. Now the youth is into alcohol. And then lung cancer, a lot of youth are smoking tobacco, and then the environment, like I said, not any fault of yours, but you have to inhale all of these things. And then also the youth, we are the ones who don't like to eat healthy. We are not liking the vegetables and the fruits, and we want the oil, the fast food, tin foods and all those. So when you don't eat healthy, basically, like I explained earlier, they are reducing your immune system and then causing so many imbalances in your hormones. And then when all these things are not working rightly, your chances of what are high. So the youth, because of the way our lifestyle is, we're actually prone, you can see most of these, cancers.
Sometimes I just wonder how we have so much information now as young people, using the internet, what to do, what not to do, and we allow ourselves to be at risk. The alcohol intake is so much. Now we don't just take alcohol, we mix it with other hard drugs.
Exactly.
And it's really killing us. Now I can't even say, at first you could say, oh, the guys, the boys. But now we, the girls, we drink even more than some guys. So if you're watching this episode, I just want to encourage you that in as much as we would always say that we are living our life, we are having fun as young people, but I think that we need to take responsibility of our actions. one day I was just thinking about these appeal for funds that we see. Of course, some genuinely may not have involved themselves in these kind of things, but some who have, at the end of the day, they are appealing for funds, and when they are not getting, they think that their friends are bad, their friends have deserted them, but we have brought some of these things upon ourselves. So I just want to encourage everyone watching me or watching this episode that let's be careful about some of the food we eat, some of the drinks that we take. And even if possible, you know, COVID came and helped us to wear nose masks a lot. But even before COVID, I saw a lot of people, even in the North Tamale, wear nose masks a lot during Hamatan. So when you are going to a vicinity where there's pollution or whatever, I just want to encourage you that just pick up some nose masks and put it on. For those at the villages, we may not have a lot to say about that, but at least just try not to always be, you know, sometimes you are there, the smoke is coming, you are even using your mouth to even blow the air. Let's try to take responsibility of our actions so that we will not one day be crying because we have cancer. Maybe you've touched on it a bit, but let's go back to preventive measures. I think at this point, let's go back to it a bit so that it can stay in our minds.
So the main prevention is to regularly screen. That is, for me, the main thing, to regularly screen. If, let's say, you put it to yourself that in a year once, I'll go and get screened for every kind of disease, not even just cancer. So you walk into the hospital and say, you are not sick, but you want to know whether you are sick or you have, you know, chances of being sick, or maybe you are even sick and then the symptoms have not started, you know, showing. So you just want a checkup. Once a year is fine. If you can't do once a year, once in every 2 years, I mean, just make an effort. So the prevention basically will be screening. But the others too are there. Let's eat healthy, you know, let's exercise. You know, obesity, if you are obese, try to reduce your weight, and then the bad cholesterol and all those things. Then if you are genetically exposed, a parent has had cancer before, a sibling has had cancer before, your chances are high. So you should even have more regular checkups on, you know, on this. And then the environment, like I mentioned, you should try to, you know, avoid polluted environments. The kind of chemicals we are using to fish and to farm, we should avoid them. Because you, the one using them, are more exposed than the one who probably even eat it. So if I avoid all these things, do your checkups, eat healthy, exercise, you'll just be fine.
You'll just be fine.
Yes.
So now, there are some questions I want to ask, but I don't know if it's appropriate for TV and all that. With cancers, we've had people sometimes feel that it's spiritual. Have you heard those kind of situations?
Yes, I have nursed a lot of people like that who think that somebody must be the cause of that. Yes. So our belief systems are different. Not even cancer. Someone has a malaria and thinks it must be somebody who has caused the malaria. So that is a person's belief. So you will have to understand the person's belief and be able to educate the person that this thing is caused by this. These are the risk factors, A, B, C, D. When you combine them, can result in this. And then with this is how we can manage it. When we give you this, it will help you to do this. If we do a surgery, this is the purpose of that. You know, when you give all these explanations to the person, it will make sense to them. So this belief that they have, maybe, I mean, they believe it so much that saying it once like this will not probably change their mind. But if the person is a spiritual person and having beliefs around this, you can bring in a spiritual person who will help the person in that regard. Because like you rightly said, people believe in these things and they can give testimonies that yes, it was caused spiritually, and I prayed or I did the sacrifice and it went away. People have evidence or testimonies to such. So if a person is of this belief, you cannot just rubbish it.
In one conversation.
Yes, yes. But if the person says that I can do A, B, C, and it will go, I've seen that it has happened here, so I also want to try. The person has that freedom to go and try that. And if it works for the person, all the better.
Yeah.
Because I think the main aim is what? To help the person recover or, live a healthy and comfortable life.
You know, sometimes it's very tough, even on normal things, convincing people that some things are not spiritual. We are humans, and some things will happen, some things can happen. So I just want to encourage everyone that don't sometimes overthink that certain sicknesses or diseases are spiritual. Of course, we may have people that might pass through sicknesses to harm you and stuff, but you need to always get to the hospital. Unfortunately, in Ghana, cancers are not part of our health insurance. So we just have to save for our own self. And the most important thing is that we don't even have it in the first place. But not just about cancers in this conversation. We are looking at general, effective health care for yourself. Regular checkup. That is going to help you to even prevent some of these things in the first place. Let's take a break. We'll be right back.
My name is Naima. I have a challenge with my aunt since I was in basic 5. If I'm in class learning on the board, it reflects. So I can't see well, I can't read well, so I have a problem with learning. So when I heard about the eye screen in Matter Research Foundation, I decided to come over and see how it will help me, and I'm very happy to be here today.
Welcome back. We are still looking at cancers, how we can effectively help ourselves not to be at a higher risk. Of course, even though all of us are at risk, based on the risk factors that have been mentioned to us today, but we believe that we can help ourselves not to get that far. Because sometimes you even, I heard a mother talk about the struggles her son went through going through chemotherapy. And I was like, hey, that was a few years back. And I was like, hey, children also get this cancer thing, because I thought it was basically adults.
Yeah, children get cancer. In fact, there are units for pediatric oncology in most hospitals. So it means that children get cancer, and in fact, a lot of children get cancer.
But you mentioned that it takes years to get to the last stage, or what stage. So children, how many years are they born, and sometimes less than 15 years?
Yeah, even neonates. So sometimes the diet of the mother can, be a risk factor for the child. And then the genetics I mentioned. The kinds of food we eat actually. See, children born these days with so many abnormalities. That was not the case in those days. But now we have a lot of children born with so many abnormalities. It's basically our lifestyle, that is bringing all this. So yes, the child is not exposed much, but the mother was probably exposed. Yes, so we have, children having cancer. The common one being, leukemia, cancer of the blood. A lot of children are being diagnosed with, blood cancer.
Blood cancer?
Yes.
Like something is wrong with the blood.
So the blood, abnormal cells are growing in the blood vessels, and
Hey.
Yes. So you can imagine blood flows almost every part of your body, and then it's having a problem. So a lot of children.
So that one, how when I was a kid and they talk about HIV, they said it's in blood, blah blah. So why don't they pull out all the blood? Pour water inside, shake the person, wash it, pour it back, and put new blood inside the person.
Yeah, so for leukemia, actually, one of the treatment options there is a bone marrow transplant. the bone marrow is the one that produces blood. So if they're able to replace the bone marrow and put new bone marrow, that is one of the treatment options for that one.
Wow.
I don't think that is done in Ghana yet.
And all these are very expensive. They have to
Certainly.
fly you out of the
Certainly.
country to go for these transplants.
That's true.
It can even take your whole family's money. It may not be enough for you.
Yes, and children that suffer from cancer, you can imagine the whole family is affected.
True.
The whole family is affected. So if the mother was working, cannot probably even go to work again. So how does income come, from that angle? So it affects everybody in the family. It affects even probably neighbors and then the community at large. So the government has to come in terms of cancer treatment, maybe be able to absorb, the treatment for cancer.
I hear the president is trying to add up mental health to the health insurance. I can't wait to have even these kidney transplants and then cancers. We can't wait to
Dialysis
get
and
dialysis.
things,
Yeah. We can't really get. I can't wait for Ghana to get there because sometimes I feel that don't we have a fund? Maybe we can get a health fund where people can probably donate like all year round. You don't have to donate because that's your family member or something. Then when the person is in need, we treat the person and even continue like the donation. Like money can come later on. Because you see people, one of the donations that really hurt me was there was a nurse that people were appealing for funds for her. And I'm like, a nurse for kidney.
So that makes it true then. So even as health workers, we don't have probably an insurance package
Yes,
for that.
yes.
So once you are sick, and then
At least the Ministry of Health could easily do this. Anyways, I hope we get better very soon as a country. Give us your final words, everything on cancers, things that probably you couldn't have mentioned, or just reminders that we can have in our mind.
Yeah, so cancer is treatable if detected early. So my last words are for us youth, let's make use of regular screening. When we hear there's a screening for this, let's make time to go and screen. Let's change our lifestyles. Let's eat healthy. Let's exercise, and then be conscious of our health. Let's be conscious of our health. If we are conscious of our health, we'll be able to detect diseases at their early stages. And when we do so, there will be help, there will be treatment, there will be management for it.
All right. Thank you so much for joining us. I believe that this episode also go as far as your first episode did. I've been speaking with Madam Warren-Yang Margaret. She is a palliative care specialist here at the Tamale Teaching Hospital in Tamale. You can get in touch with her. Get in touch with us on our official numbers on your screen. We can share her contact details for you if you want someone to take care of your relative or yourself who is in need of a palliative care nurse in your home, especially for the elderly. Even though it's beyond that, you can get in touch with her, and she's very affordable. She's very affordable that she can give you some great and professional services. We've had so much knowledge or information on this episode, and even in our previous episodes. I just want to encourage all of us to really take our health very seriously, because I want you to stay very long on this earth. I want you to live very, 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 very long, because your family needs you, Ghana needs you, the Reflection Show needs you, the Martha Inspires Foundation needs you. And when I'm campaigning to be the president of Ghana, I need your votes. So you need to stay strong and stay healthy. The Martha Inspires Foundation, we are still appealing and asking for support for our reading clinic, support for our donations, and all our youth activities. You can go to our website at marthainspires.org and learn more about the foundation, and also on Facebook, Martha Inspires Foundation, on YouTube, Martha Inspires. You can see all our videos and all our activity videos on YouTube. Give us a call
on 054 9578 512. 054 9578 512. Get in touch with all our activities, the Reflection Show, our community engagement. If you want to get in touch at our office here in Tamale, just call that number and you'll be directed accordingly. Thanks so much for watching. I'm Martha Inspire. See you same time next week.